Good evening. I'm calling to order the June meeting of the Public Health Authority of Cabarrus County. First on the agenda is adoption of the agenda. Can I get a motion to adopt the agenda?
I make a motion to adopt it.
Second.
Got a motion and a second. All in favor?
Aye.
Anybody?
Aye.
Aye.
I have to call the roll, unfortunately. Who's it? Daryl Adams,
Aye.
Kim Daylor,
Aye.
and who else do I have on there on the board?
Asha, I can't tell if she's on.
I think it's Asha,
Are you there?
Kim.
Why don't we do a roll call?
Yeah, it would just be Asha, yeah, that's,
I think it's Kim and Darla.
Okay, got it. Okay. So motion carries. And then, next we have approval of the minutes from the May 17 meeting. We've had a chance to look at those.
I move for approval with one change that I mentioned earlier to Bonnie.
yeah.
Okay. we
It
have
says
a-
Stephen Morris motioned, it should say Stephen Morris moved. In the last paragraph.
Okay, so we have a correction in the last paragraph. Stephen Morris moved. So one exception. So all in favor of adopting the minutes with the noted change, say aye.
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 Daryl Adams,
Aye.
Kim Daylor,
Aye.
still don't say Asha, okay. Motion carries. And now I'm opening the floor to informal public comments.
Ryan, did we have any questions or comments submitted?
There was nothing in the inbox.
Okay,
So it's indicated there was nothing in the public account, so moving on. Next is nomination and approval of new officers.
Madam Chairman, I did just see a message from Asha that she is on. Yeah. But I don't see her up there.
Probably where it says +2,
She must be the plus
the
two.
plus, yeah.
Hi, Asha, can you hear us? Okay,
While we're waiting, I know it's a formality, but we should do a roll call
okay,
at the beginning of the meeting to establish the forum.
okay. So while we're waiting, Mark Spitzer has requested a roll call.
No, we don't have to do it.
yeah.
Huh?
It's typically.
No, you want me to do it now? No? I just sort of did the online roll call.
So Asha says she's in.
She is in.
Everything, but you can't hear her. She says, I've been yelling and I like a idiot.
I wonder if
Asha,
she's
you're
on the,
Hi, everyone. I'm on. It's Asha.
Oh, hello, Asha.
Welcome.
Hello.
Okay, so we have just, we're opening the floor for nomination and approval of new officers.
this may seem somewhat unusual to you since we just within the past few meetings nominated Laura for chair and Mark for vice chair, but our bylaws do say that every June we reinstate or renominate or elect new individuals.
Madam Chairman, I would like to nominate Laura Pons as chairman and Mark Spitzer as vice chairman, if they would be agreeable to continue to serve.
And I second that motion.
Got a motion and a second. Any comments or? I'll take comments now.
Other nominations?
Other
And I would
nominations?
add to that, my motion, that they be elected by acclamation.
I've got a motion or acceptance
second.
by acclamation and a second. All in favor?
Aye.
Aye.
Daryl Allen,
Aye.
Kim Daylor,
Aye.
and Asha Rodriguez.
Aye.
So moved and passed by acclamation.
Thank you.
I will serve as chair and Mark Spitzer as vice chair. Thank you for this honor.
Thank you.
So next we have reports.
Yeah, we have on the call with us today, Merle Green. And Merle Green is the executive director of the Association of North Carolina Boards of Health. And I, as the health director here, I join the other 85 health directors every month, generally in Raleigh, for monthly meetings with state representatives and fellow health directors. And a few months ago, Merle presented to us about how the North Carolina Board of Health Association is looking to engage with local boards of health. And as one of our goals is to engage our Board of Health more here in Cabarrus County, I thought it would be wonderful to have her come onto a meeting and spend 10 minutes or so telling you all a little bit about the Association of North Carolina Boards of Health and what resources they have available to us as a board, and allow you to ask any questions. So Merle, again, thank you for joining us, and we look forward to hearing your mini presentation and then having a discussion afterwards.
Sure. Well, thank you so much, Bonnie. And thank you to the Cabarrus Health Alliance. I am very proud to be with you tonight and thankful that you saw fit to give me a few minutes of your time. As Dr. Carl said, I am Merle Green. I am the Executive Director of the Association of North Carolina Boards of Health. I'll probably refer to us as ANCBH for the rest of this meeting because that's a mouthful to say the Association of North Carolina Boards of Health. And the association exists. I think that our title is very descriptive. We're here to assist boards of health and board alliance boards, or whatever the board is called in your county, in doing the work that the general statutes appoint you to do. We know that health departments, health directors, boards of health, alliance boards, consolidated human service agencies, all of the above have to look out for the health of a community, and your work is population-based. So we here at ANCBH are here to stay in sync with you. Our priorities are your priorities. We know that across the state, for the last 2 years, the big topic has been COVID. And we were able to assist counties with grant writing. We were able to assist counties with moving some equipment around at times. We aren't really a logistics firm, but when they needed consultation on where to go to receive assistance, we were there with information. We have helped departments write job descriptions, temporary job descriptions for temporary workers during COVID. We've done a lot with that. And while we're on the topic of COVID, just as the example, since that example came out first, we also know that your workforce is probably at its limit when it comes to the number of hours that they have put in addressing COVID issues. And one thing that we are doing is making boards of health aware of that and helping them to design ideas for supporting the public health staff through this type of emergency or any type of emerging situation. So ANCBH is here to make sure that we stay in lockstep with local health departments, I do attend the meetings, the monthly meetings of the Local Health Directors Association to make sure that whatever they have on their hot list of the top 10 things, let's say, to do most immediately, we're there supporting them. We recently were able to write letters to Congress people on behalf of our state regarding such things as workforce development, maintaining our workforce. We know that during this time of people leaving jobs and some not returning, we do need the healthcare workforce, whether they're working in public health or in a hospital or private industry. So we have been educating and working with legislators to look at ways of retaining the public health workforce and the healthcare workforce in general. I know that some of you are probably physicians and pharmacists and veterinarians and all the type positions that are required to be on a board of health. So you surely are addressing that same situation, no matter where you're working. Over the last couple of months, I have been offering myself to district health departments, to single county health departments, to the consolidated ones, and to the regional health directors to come and meet with you one-on-one directly. We have had all the meetings virtually so far, and that's been very convenient. But we have found that meeting one-on-one with counties, or at least maybe 10 or less in a group, allows us to have a more intimate conversation and to also discuss topics that might be more relevant in your area than across the state. We know that as we go from Murphy to Manio, the situations that are most urgent in some areas on the coast, for example, might not be in the mountains or somewhere in between. So these types of meetings have allowed us to reintroduce ANCBH to the health departments across the state. And it has also given the boards the opportunity to share information with us that they might want us to address on their behalf. An example of one thing that we're addressing on behalf of local boards of health is the fact that all health departments are required by the consolidated agreement that they signed with the state to provide in some way pharmaceuticals for their patients. If the health department does not have an on-site pharmacy, then they must contract with a local pharmacy to make sure that health department patients and clients have access to the prescription medications that they might need. As we surveyed pharmacists and health directors and staff, leadership staff, health departments, we found that many are open to us helping them with creating a model public health pharmacy. We wrote a grant, we designed the model pharmacy, we wrote a grant and submitted it to CDC. Unfortunately, their letter to us said that we have a fine proposal, but their finance ran out before they got to our proposal. So we are going to try to fund that grant in state. We will be sharing that. It will take several months to get it all together, but we'll be sharing that with all of our health departments. So one advantage in ANCBH is that whatever we develop is open for all 100 counties, all 86 health departments in our state. We share the information widely, no matter where it originated. We look forward to sharing that with you pretty soon, and hopefully every county can benefit from that. Whether you have a full service on-site pharmacy or not, we think we have good information. We actually right now have 5 pharmacies of ANCBH, and that's why we were so comfortable creating a pharmacy project. But we will address issues in any area of public health that is needed. Are there any of you who are familiar already with ANCBH, have been around the state long enough to have known some of the other leaders or the founders? Bob Blackburn, is that name familiar to anyone? No? Okay. Well, ANCBH came out of a group of public health leaders who saw the need to create one entity that supported all health departments throughout the state. We were actually the first official one in the United States, and now many states do have associations such as ours. There's now a national association, but North Carolina does get credit for starting this entity known as statewide boards of health. We've addressed issues from childhood vaccinations to adolescent health services, to geriatric and elderly health care, to school health services. Many of our counties have school-based health clinics, primary care services, as we just said, pharmacies, wellness, tobacco, smoking, all of the above. Whatever topic has been the most relevant to health departments, we have helped them to address it. So let me just ask you, so with that background, let me just ask you in Cabarrus, how are we looking in Cabarrus County? I have looked at some of the statistics, and your population seems to be as healthy as any population in our state. And so Cabarrus seems to be doing a great job at providing public health services. You have a dental clinic there, as I remember, a lot of great services. If there were 3 or 4 or 5 areas, though, that Cabarrus might say to ANCBH, would you look into this and just see if anything could be improved, added to, expanded in Cabarrus or in our region? What 1, 2, 3, 4, or 5 topics might you toss out?
Well, from a very uneducated point of view, I think we're doing an excellent job in Cabarrus County. I think that as I talk to other people across the state, the things that I tend to hear are very positive in comparison. It seems that we may be offering some things that perhaps others are not. The question that I would probably ask is, what are the things that maybe we're not doing that we should be doing or could be doing that we're not aware of? And I certainly think that Bonnie and her staff does an excellent job of keeping up with those kind of events. So I feel pretty comfortable that those get brought to our attention.
Yeah.
Absolutely. Cabarrus does have a great reputation, and Cabarrus does lead the state in a lot of areas, and a lot of counties do look to you to look at your models and various things. Let me ask a question. Does your health department have animal control, or is that done by the county or the city or something?
That is the responsibility falls under our sheriff's department.
Sheriff's department has. Okay.
But we'd be glad to swap it off if y'all.
You've done such an amazing job that we really think it.
The animals are really appreciative.
And I was talking with one county.
One of the most controversial things we do. Yeah.
I was talking with the county recently, and they had an increase in rabies cases. Not that they were off the chart. An increase meant 3, but that's a lot because we don't get many of those at all in our state. But it is summer season, and so they were asking us to do some research about educating the population about aborting rabid animals and things. As I said, one county or one region was looking at a model for medications and pharmaceuticals in their region. Many of them were in smaller counties and did not have an on-site pharmacy. So they wanted a model or a more consistent way of contracting with the local pharmacies. We've worked with some, we've had several counties who have mentioned burnout among staff and what could boards of health do to help staff to know, how they are appreciated or how they could possibly even rearrange services sometimes to help staff with the work overloads. I know that out of that, one county has stopped doing their special COVID clinics, and they have incorporated COVID vaccinations back into their regular clinics. They felt that they had basically saturated their county, and now they could accommodate COVID vaccines in the regular clinic rather than have special ones. And that took some extra work off of staff who might have worked weekends or late nights to have special clinics. So sometimes just talking about a basic situation out loud, even if we don't actually term it a problem, just a current situation has helped a lot to move things along and go on to the next generation of public health.
So I'm relatively new to the board. And one of the things that I think is especially important here and allows us to do as much as we do is the relationships that we have throughout our community. And I believe that that is not always the case for other health departments. I think if that is true, because of the great benefit we receive because of those relationships, I think your organization could be very helpful to other health departments in helping them to understand, and we'd be happy to share our perspective on this, how to establish relationships with both private and public entities within their counties.
I think that's great. We know that one of the biggest emphasis on Public Health 3.0 is partnerships. And they do encourage public health to partner with the local entities, whether it's the local FQHC. I know you have a booming FQHC there in Cabarrus, on their local hospital, the local private medical offices, pediatricians' offices, the universities. I know you have a research center there in Cabarrus County. I think that you have a research center person on the board. I'm not sure who that person is, but you're exactly right. Partnering with, and none of us can do this alone, whether it's the large hospital or the FQHC or the well-funded private practices, no one can do this alone. And I don't think that anyone would even try to. I think they would all admit that it takes a village. So definitely partnershiping, if Cabarrus County has created a scheme or a plan, scheme in a positive sense, or a plan that works, or a way of bringing others to the table that has worked for you, definitely I feel that other counties sure would give a few minutes to hearing it and learning from that and benefiting. If we want to pursue that further, Dr. Coyle, we're working with the UNC School of Government right now to do some training. We're going to advertise it soon about governance in public health, your options for governance and operating your public health department. It's coming out in August, but maybe mid-fall, we could look at some training regarding partnerships and developing key partnerships, so that maybe we could highlight some of the success that Cabarrus County has had and make that a webinar or a training with the School of Government once again.
Yeah, that's a good idea.
Sure would. I think the other board members in the other 100 counties across the state would be interested in that, and they could share some of their best practice models and just make it a nice training session for all these people who serve on their own local board of health.
Does anybody have any other questions or comments for Merle?
Well, that's right. I'm sure that my 10 minutes are up and over. So I've gone over the time. I think I probably owe you back a few minutes. So I'll find a way to give you back your time at some point. But thank you tonight. Thank you, Bonnie. I love working with you. And board members, you have an outstanding health director. Keep her for a long, long, long time, and continue to make Cabarrus County one of our outstanding public health alliances in the state. We'll keep looking to you, and we will work with Bonnie on possibly having some training that highlights some of the other successes in Cabarrus County.
Thank you.
Thank you.
Thank
Thanks
you.
for taking time to be with us.
All right, and I'm going to sign off.
Thank you.
Thank you.
Thank you. My pleasure.
Next, we're moving on to financial summary report with Sue Yates.
Good afternoon, Board. I am bringing the 3 monthly reports, so you can take a look at those. As of the end of May 31st, our revenues are over our expenditures. We did hear from the state about our Medicaid cost settlement last Tuesday. That will come in around $3,097,000. We have not received the funds for that, but I am excited that we at least got the number in June and not July like last year. So I feel some progress has been made on that. The June ending financial reports will include those funds that we were notified in the month of June. Does the board have any question about the summary report at this time? Okay. Our next report is the snapshot. All of our departments are green. I did leave clinical services and behavioral health as light green. We are working through the Medicaid managed care issues. Each day we feel like we resolve one item and sometimes another one pops up right after it. But we're working through each of those, and behavioral health, you'll see some budget revisions in for them as depending on when the money came in, we were able to hire some folks that, but that department should be in full swing next year. Our next report that we have is the variance report. It compares where we are this year in May to last year in May. As you can see, Cabarrus Health Alliance has grown significantly even over last May to this May with additional funding for the year. So those are your 3 financial reports, and I'll be happy to answer any questions.
Well, the one that says large grant received for school health additional staffing, where did that grant originate?
That grant for the school health staffing originated at the state level with ARPA dollars. It was to get an assistant in the school to help out the school nurses to help with the workload as school started back in session. Those were temporary staff for the fiscal year 22 that we used as staffing agency to provide those resources.
Thank you.
Uh-huh.
The nurses have been extremely grateful for that assistant. So we weren't able to put an assistant in every single school, but in most. And especially through the height of the pandemic when they were doing sometimes, dozens, if not 100 tests in a week, that was a lifesaver for them.
Well, I think it's amazing that you were able to secure staff to do it.
Yeah.
During a time that it's hard to hire folks.
It's actually has us contemplating a model where we might have these assistants, not for every school again, but could we find some grant dollars or figure out how to make these assistants available to groups of schools? Because the nurses have said it has been just incredibly helpful, especially for things like when they have to do screenings and reviewing of immunization charts and, those tasks that have to get done that are very time consuming, make it very difficult to continue to, see the volume of kids coming in when you're also then trying to do all these other sort of administrative tasks we're required to do as part of the school health program.
Well, and I would imagine that, we have such a great variance in the populations from one school to another, 1,800 kids to 2,000 in a high school, and as few as 300 or 400 in an elementary. So there's really not any, previously they have not had any additional support staff for those higher population schools,
And
right?
so for those more needy schools, the ones with the larger numbers, if we could build a model where we start to have some support staff that could.
Yeah, I think in our, annual budget for the county, one of the questions that was presented during our public hearing, was, have we attempted to get competitive bids for our school nurses? And I think the answer was no. And the question in my mind was, who would be willing to do that? I think we talked about it a little, I mean, let's say Atrium was interested in contracting to provide that service. They probably would not be eligible for this sort of grant funding that we are here at the Health Alliance, or would they?
I believe, Sue or Aaron, correct me if I'm wrong, but I believe this particular grant was given directly to the school districts if they were
To the school district.
if the school district was the one who hired the nurses, then the money was given directly to them also. Is that correct, Aaron?
So I think there were a couple different mechanisms. Some funds may have come through the Department of Health and Human Services. Some funds may have gone through DPI, but the funds went out earliest through public health departments that employed the nurses.
Yeah.
Admin.
Yeah, so if
We certainly have access to more dollars because the nurses are coming through the public health department than what other
Right.
areas might.
Yeah, that wasn't something I really had thought about.
It also just provides for an efficiency of tying other public health programs to, again, as Aaron said, we were one of the school districts able to get these assistants in and operating fully. You know, we were up and running very quickly
Right.
because it was coming from the public health department. We were able to roll it out quick. We knew the protocols and that we needed to put in place because of COVID. And so it just created a lot more efficiency.
Thank you.
Yeah, I don't really see how there's any, I mean, I think this health systems might do it as a public service, but there certainly isn't a business case for you to do it. It's cheaper to directly contract. The cost of the nurse is the cost of the nurse. There isn't really any advantage. I mean, and that's a market rate. So I don't really see what the advantage of outsourcing that would be. There's no opportunity for margin. It would be basically community service. You got to pay a nurse what it costs to do the job. And then the benefits and the infrastructure to manage that. I mean, there's a slight amount of leverage with, whatever we have, 8, 10, 12, 15,000 nurses, but there's not much.
And that's very helpful to hear that from you.
I wouldn't.
I think the question was posed, have you checked this out to see if you could do it?
That's not, well, I mean, you don't charge
charge
the kids for the service, so there's no margin in the business. It's purely community service. So would either system say, there's a county that's in trouble, we serve the community, would you supply nurses? I'm sure people would figure out how to do that. But I mean, if you have my wife is a school nurse, the school usually pays for it. I mean, that's traditionally out.
I think it would be interesting, Asha,
yeah, you can ask Asha, she's been in other parts of the country. Is there any place where that was a service provided by a?
Well, Atrium used to provide that for Mecklenburg County.
Well, they had the contract to manage it, but the county fired their people who managed. It was a managed contract. Some of the people were employees, not all of them.
So I think this individual's approach was, can you save us money? Can you save the taxpayers money? And my off the cuff
On the top of my head, and again, Asha's managed this probably more than I have. I don't see it, but
I would say that it would be a bit more complicated. to be able to execute on something like that. I think there's probably likely multiple reasons why, at least in Mecklenburg, Atrium discontinued doing that. You know, we are certainly looking at employer models to be able to support employers with needs. And that could be similar of a model, but I would say it's probably a little bit more complicated to be able to execute based on the employment relationships with the individuals that we would walk through. And that's at this point, we're being very careful as we move through those types of relationships moving forward. Certainly, if we needed to be able to support, we would continue to look at ways to address that. But it's just not something I think at this point, particularly also with workforce challenges, that I'm not sure we would be willing to move down in that direction. But Bonnie and Aaron and Mark, certainly we want to be good stewards, and we also want to be good community servants. So if there is need, certainly we could walk through it. But I think this would be more of an exception rather than the norm for Atrium moving forward.
And again, I was around for that. I think the discussion around Mecklenburg County was very complex because the psychiatric hospital was tied up in that contract too. But for the most part, that decision was a financial one the other way, which is Mecklenburg County thought they could do it less expensively than contracted out. I would say, in my opinion, that maybe not have worked out as well as they thought, but that's where we are.
So, go ahead, I'm sorry.
It would be my sense, if I'm hearing you, Asha, that you have other important issues that keep you more than busy, that adding this type of program, which adds additional headaches and complications, would be difficult, would be done if needed, but as long as CHA is able to do it, that would be your preference. I think I hear you saying that.
Oh, that's correct. We're always here to support, but I don't know if we would manage it, certainly would not manage it better than CHA, in my opinion, and it would come with its own significant challenges because the model is so much different. But we are here to serve.
So if I were to respond to this individual and say that we have had some very surface preliminary conversations with Atrium about the question that was posed, and the response that we received was that it is not something that they would likely pursue, or that they feel that they could do more efficiently than we currently are doing. But if we are in trouble or in an emergency situation, they're certainly willing to try to help out, but that's not a business that they're interested in pursuing. Is that accurate?
I don't think we do school nurses anywhere in any of the counties or surrounding counties, anywhere that I'm aware of.
Yeah.
And Asha, have you been any, I just don't recall.
No, we have not been in.
Okay.
So yes, that would be accurate.
Yeah.
Yeah, I just wanted to have an answer to go back to say, I heard your question, I heard your concern, and pursued it with some very preliminary conversations, and here's the response I got.
The other thing that I would add to that, you and I've talked a little bit about this previously, is your point, which I had not heard before, but I think is really very central, and that is the alignment with other public health programs, the ability to cycle folks into programs that are provided by CHA that would be, again, more burdensome for Atrium or any other healthcare system, or some kind of agency that somehow was able to employ nurses. I think that is That is a content, if you will, answer of importance, right, to this individual.
Yeah, we get so few, we had our public comment session and had
To go downstream referral benefit, I mean, the kids, come to the primary care doctors, they're not, kids aren't in the hospital very often. Usually not directed by a school nurse anyway, so I don't really see where, and I don't know of any private nursing agencies or companies that compete for the business out there. So it's not like it's a nursing staffing agency that's saying we supply students, at least I've never seen it.
I certainly wasn't, but that's not my area.
It's very challenging because all of the certifications that you need and, we help cover that and then give them a certain amount of time to get the certifications. Yeah, it would require a whole infrastructure that would be difficult for some.
And to Dan's point, any company is gonna have a markup that CHA doesn't have.
Well,
There's gonna be some percentage of additional cost that is going to be associated with the core costs.
well, and we know that Atrium pays their nurses a little higher than what we pay.
That's, there's always that issue around who's pay scales that they get paid on, how that works.
If I could interject as well, one of the things we ought to consider is that, and I think Dr. Coyle mentioned that the certification that comes with the school nursing that takes place, as well as the wraparound services that CHA provides beyond just school nurse. In other words, we're talking about school nurse. There's also the other services that CHA provides to the schools, dental and other things that the schools find very valuable.
Absolutely. Yeah. We work with to me, a school health program is more than putting a nurse in every school. As Darrell mentioned, we have our dental program that goes to the schools. We have a number of prevention programs and counseling type programs that go into the school. And so you get this all sort of integrated and it's a nice model.
Absolutely.
Yeah, I think you're going to see more behavioral health happening.
So do you think that our local elected school board is aware of all these facts? Just, I guess that's an opinion question. I'm not sure Darrell might can speak to it on the Kannapolis side. I don't know about the Cabarrus County side.
I can speak to Kannapolis. Kannapolis School Board is aware.
Yeah.
Yeah, and we can certainly reach out to both school boards and offer an educational presentation to.
Yep.
Bonnie, this is Asha. I think to your point earlier, there's a huge benefit in terms of navigation to public services. Frankly, sometimes, when you get into that piece around private or health systems, it can be a little bit challenging in that conversation. So it could be a little challenging in that conversation. And then you really have to educate the staff properly, to your point, to make sure that they know all of the resources, community resources available to them. So I just kind of put that out there, having that type of connection to you all as well as to the county for resources are really important.
Yeah, and then maybe after the next election of school board members, that
would be a great time to go.
Yeah, just to get the new members up to speed and just help them to understand that it's more than just the school nurses and what these other benefits are.
Yes, you probably know this. Kannapolis just had his election for school board members, and the two who ran have been reelected. So school board did not change.
Yeah, so we're probably good in Kannapolis. Cabarrus County is probably gonna have some turnover in November.
Well, you guys, at least one.
Yeah, yes, definitely will be at least one.
Good point.
Darrell, I know you're saying that your school board is very educated on the full array of services we provide, but one thing I did when I was in Pennsylvania is generally once a year went to the school boards where that we were working with there and gave just, an update and kept it brief, so if that is something, I think that's something I would like to offer to both school boards as a way of just maintaining good relationships and just, here's an update, this is all that we accomplished last year, working with you, here's how the health of the students has improved as a result, and then answer
I think
questions.
that's an important engagement that is, that has to be established from, at some particular point in time, so as to help them to help you to set priorities as well.
I think it's an excellent idea. I know I can probably get this set up for you on Canapolis side. Just let me know when. I think you'll be more than happy to have you present to the board.
Okay, I'll reach out to you to get a sense of, when, seasonally, when's the best time to come in, and we can get that set up.
Okay.
Yeah, I think we will see this evolving, but I received a rather lengthy letter from one of the school counselors in the Cabarrus County system just this past week, and she was referring to the amount of mandatory classes that she was required to teach that took away from the actual counseling time and some of the behavioral health issues that existed. And just kind of an overall, it wasn't a complaint letter, it was more like a awareness letter, but I think we'll probably see more of those, and maybe that some of those might be issues that the Health Alliance can assist with, and it might be issues that maybe down the road, somebody may have to fund some of these behavioral health positions, whether that be the county or the state, or, but the needs seem to be increasing.
Oh, yes.
That's my perception.
Oh, leaps and bounds, unfortunately.
Yeah.
And I'll probably, Steve, let's get political. I'll probably argue that should be funded also from the state level, as they understand the need for school psychologists and social workers. I think there needs to be a push at the state level for them from DPI to fund it as well, those positions.
Yeah, and I think that that is a topic that we need to sit down with our General Assembly members and talk about, now whether that is the Health Alliance, or whether that is the school boards, or some combination of the two. But I think that you will find that particularly we will have 2 new House members representing Cabarrus County, neither of which probably have had a great deal of exposure to those issues.
But we do have Kristen,
who is highly competent, yes.
Knowledgeable.
Yeah. All right, Laura stepped out of the room, so I will just ask Steve to go next with the workforce development report.
Hello, board, and everyone else. It's been a while since I've been here, so it's good to see everybody. The CHA Workforce Development Plan is needed to be presented in front of the board as part of our accreditation, and so that's what I'm here to do. Next slide, Karen. All right, this is just a brief staff overview, and actually how I think about what needs to be done when we're developing our workforce. So currently we have 270 employees, and actually we have 24 open positions posted. So likely we'll be at 300 before the end of the summer, over 300 employees. Clinical roles, we have 110, and non-clinical roles, 160. And then our total number of supervisory staff, which would be what we need to look at for our leadership development program, is 46. Next slide. So this is the methodology that I tend to use, and it's a very well-known methodology, probably the most used methodology in the world for developing training programs. And it's very simple: the ADDIE model: analyze, design, develop, implement, and evaluate. A simple 5-step process. And when you're looking at development areas, when you're thinking about most skills can go into 4 buckets. So it's technical skills, interpersonal skills, strategic thinking, and then we want to make sure we have our compliance training completed. And so these are just the types of training. Of course, this isn't all encompassing, but just to give you an idea of what I mean when I say technical skills, MS Office skills or new technologies, interpersonal skills, strategic thinking, and compliance. So these are just some examples. And then more specifically, when we're thinking about leadership development, this is just designed to show that each level has a different type of skill set that they need to be developed. So when you're on a front line or more of a frontline type supervisor, you need more technical skills and interpersonal skills and less strategic thinking skills training. And as you go up, the need for strategic thinking goes up and the need for technical skills goes down, because you're dealing more with employees one-on-one with various types of issues, and you're not necessarily doing frontline type of work. Next slide. And so we've already started a lot of the things on this workforce development plan. So here's a brief timeline. And again, these highlights aren't all encompassing, but just I think some of the biggest things we did, first, obviously we had to do a training assessment, and we use various methods to do that. And some base level training with implicit bias and public health 3.0. Year 2, our learning management system, NeoGov, has been implemented. We're still working a few kinks out, but by and large, it's been rolled out to all staff, and that gives us a greater level of, or a new level of on-demand training. And another big thing we've done is restructure new hire orientation, and we've done some basic hiring practices type training for supervisors. Next slide, please. For year 3, we want to do a formalized year-long training schedule that is in progress now, especially with equity. We want to do some train-the-trainer things, and not just equity. A lot of times when you're talking about diversity, equity, and inclusion, people do get tired of hearing the same voices. And one of the ways to combat that is to have a group of people in your organization that understand some common language, have a interest in training DEI, and are able to give various training from different perspectives. Next slide. Year 4 and 5. So by year 4, I want to make sure we do a training reassessment. One of the biggest things I want to implement is REC training, racial equity Cabarrus training for all CHA staff. I want to implement a board training plan, expanded DEI training, and expanded external training and development opportunities. And again, no matter if you're the best trainer in the world, eventually people get tired of listening to you. So that's one of the reasons I want to expand the external training opportunities. And that's it. Anybody have any questions?
And say those initials out loud again, what I didn't hear.
Diversity, equity, and inclusion.
Diversity, equity, and inclusion. I
Yes.
thought DEI means Dale Earnhardt Incorporated.
There was another set of initials there, REC.
Racial equity.
Racial equity Cabarrus.
We need a cheat sheet.
Cheat sheet.
So we don't look ignorant.
We'll have to remember to spell them out the first time they're in a presentation and then put the initials after.
Yeah. Good presentation, Steve.
Thank you.
Okay. And we
Yeah,
got
thank you.
Thank you.
on for the equity
Thank you.
assessment.
Keon?
Hey, good evening, everyone. Can y'all hear me okay?
Yes.
All right, well, good evening, board, and good evening, guests. So just to give you a brief overview of my presentation, I'm going to give you a good summary over all of our strategies and implementations in reference to our proclamation, as well as the results from our equity assessment and how that ties into the development of our equity action plan. As you see in the presentation in front of you, for our fiscal year 21-22 proclamation progress, we have completed over 37% of our projects, and 63% remain in progress. For the projects and initiatives that remain in progress, the bulk of them are finishing up this month, and they are finalizing their action plans. In total, there were 67 total strategies and implementations. Next slide. So as we look into the progress of our proclamation and our different strategies, we want to look into utilizing a 4-pillar system to track them going forward. These 4 pillars will be policy, training, data, and community engagement. And as you look at the sustainability, we want to make sure that sustainability is embedded in all of those initiatives. So with the general breakdown, out of the 67 initiatives that have taken place this past fiscal year, 8 of them have been related to policy, 17 related to training, 17 in relation to data, and 25 for community engagement. Next slide. So with the completion of our equity strategies and implementations, these are some of the target and focus areas that have had the most significant impact in reference to this. So for our AA 466 grant, this is the grant that we've received from the CDC. This is the Advanced in Equity Grant. And from that grant, we've completed our APHA organizational equity assessment. We've developed an equity advisory council, which enables us to have direct interaction with members of our community, and an equity pulse team in which we receive updates from our respective departments on the different initiatives and strategies that we've completed. From an external engagement standpoint, we've recently completed our second customer and patient satisfaction survey. We completed our community partner survey, and we're currently in the process of development of our inaugural CHASM Summit, which will be our public health conference, which will enable us to reach out to the community as well as develop a community equity fund that will help launch and promote more of our projects. And finally, our internal engagement component, it comprises of our employee engagement survey, pulse survey, mental wellness survey, DEI trainings, as well as our listening strategy sessions and equity conversations. So as we move forward and look at the equity action plan, and as you've seen with the proclamation update, all of those things that lead into what we've completed from the AA 466 grant, the internal and external engagement, has helped us to develop the key steps that we wanted to identify, which enabled me to develop our equity plan template. So here are some key action steps that we want to take a look at going into next fiscal year. From a communication practice standpoint, this is what's going to be highlighted in the data and policy pillar. So we want to make sure we identify tools that measures our readability of our correspondences, as well as develop an organizational campaign to help market our equity initiatives that we've completed. From a community advocacy standpoint, we want to make sure we increase our policy and ethics committee communications. So to make sure that we're aware of policies that are coming down the pipeline, not only from a county standpoint, but also from a statewide aspect that could impact us. And then in that, we want to identify key municipal leaders that can share policy education to make us aware of key dates and key timelines that we want to be aware of. And as Dr. Steve mentioned, from a training and policy standpoint, we want to make sure that we're continuing to promote a culture of belonging. So this next fiscal year, we're going to be launching our EJ4 software on NeoGov. We're going to establish a departmental equity conversations piece in which we're going to encourage our supervisors and departmental leaders to have a space in which staff can express their employee experiences, but also to share ideas on innovation and different strategies that they would like to see moving forward. And then, of course, we make sure that we're developing leadership trainings with the TEAM trainings module. Another key component we want to make sure that we're reviewing our organizational methods of tracking our equity initiatives. And as we're doing our community engagement, we want to make sure that we're utilizing the 4 pillars to categorize our strategies. We want to make sure we sustain our internal and external equity councils. And then we want to identify resources that helps us to monitor the diverse vendors that is out there for us to compete, in the future, utilize them for future businesses and services that we can solicit through our organization. And lastly, we want to make sure that we assess our equitable program access and our quality of service. This data is going to help us to identify tools that measure our service quality, as well as identify key services that are missing from HMPs, and this is historically marginalized populations. One of the last things we definitely want to make sure we take a look at in developing is creating an internal equity scorecard. And these are some of the measure proposals that we're looking at bringing forth to the board as well as to our executive leaders. We want to make sure that we're monitoring our annual turnover rate and have that data disaggregated. We want to monitor our failure rate. This is where employees that separate during the probationary period, make sure we disaggregate that. We want to look at the results from our salary study data, as well as our employee engagement survey responses. And for the equity scorecard, the measure proposals, along with those things we mentioned, these are some of the key assessment tools that we utilize on a regular basis throughout the organization. So we have the PULSE survey, which occurs biannually, the customer and patient satisfaction survey, which occurs biannually, employee engagement survey annually, community partner survey is done annually, our organizational equity assessment is completed annually, and our community needs assessment is completed every 4 years. And so just in summary, with looking at these scorecard measurements and proposals, these are the things that we want to ideally consider in developing our equity scorecards. So on an annual basis, we are assessing these tools and the results from them to kind of monitor our progression as an organization. And if there are any questions or any additional updates that you would like to receive on my end, I'm welcome to answer those or set up a meeting with you at a later time to give any clarification on any questions or concerns that you may have.
Anybody have any questions for Keon?
I don't have a question per se, but I am pleased, Keon, that you have put this together in such a professional way. It's so important, and I think this kind of work that we're doing, it's like we are doing to ourselves what we suggest others do to them. And I just want to appreciate your efforts and your professionalism putting this together. I look forward to seeing it in more detail as you get to that point.
Thank you. I appreciate it.
Yeah, and I have to add that I am part of the Community Advisory Council, and you are doing a phenomenal job getting, so many different partners together and just trying to improve and to grow our community with a more, light towards equity. So that's great. So we appreciate it.
Thank you, Cecilia, and I appreciate your support on that as well.
Thank you so much. We appreciate you being here tonight.
Thank you.
We're going to move on to the environmental health scorecard.
All right, so I am Crystal Slinger. I have environmental health, and we are pursuing excellence through our program quality and staff development. Some of our key accomplishments last year is the grants that we received. Most of these are through food and lodging program. One of them is with Vector, which is our mosquito control and surveillance. Key one I would like to highlight is this bottom one here, as there was only 42 that were distributed nationwide, and we were one of four local health departments in North Carolina that received this grant. And the application that staff submitted was actually used as an example of a Gold Star application that came through. So I'm very proud of them for that.
Excellent.
Our scorecard has two parts. It's got the population accountability and our performance. So the population accountability really highlights on our two big programs, which is the food and lodging and the on-site septic program. The one that I'm kind of monitoring here is the number of failing septic systems that we have in our county. So that's a trend line that I want to see if it goes down, if it goes up, and what kind of situations that those are occurring in. For our performance accountability, two numbers. One, for food and lodging, I want to see the number of inspections that are required go up. Good trend line for that. And then for our on-site program, the average number of weeks that it takes for an on-site inspection to go out to do an inspection, I want to see that number go down. So right now we're averaging 9 weeks, which is not acceptable, and we are working on several strategies to decrease that down. And in order to decrease that down, we have asked the county for 4 new positions. So 2 of those are food and lodging, which is this green right here. And you can see the population and urban sprawl that we have for our county has gone up, and that increases the number of inspections that are required by mandate by law for North Carolina. And interestingly enough, even in 2020, with the lockdown, we still had new restaurants that opened. But we also see a big trend and uptick in food trucks that are here, not just for events, but in association with other type of food establishments and facilities.
I thought this slide was particularly helpful in showing how much growth in restaurants.
Yes, and food trucks obviously don't operate at 8 to 5, so that's a lot of nights, weekends. The Speedway event had an almost sold out event for the Memorial weekend, and there was over, I think the last count was 27 food trucks that were there, or food vendors that we permitted.
So do you permit whenever they come in the county or based on the county they register? Because they cross the county lines.
They cross county lines. We are in conjunction with them. A lot of times they have to have a commissary. So the commissary is in another county. We make sure that's permitted with them, but we inspect them in the county that they're going to operate in.
Okay. And so, this is sort of off track, but how do you, this whole issue of what they call ghost kitchens or whatever they call them, where these foods are prepared for a restaurant somewhere else, or they have the restaurant food and they have a different name, but they're basically for pickup.
Yeah.
For, you know, Grubhub or whatever. Is that, who keeps track of all that?
It's more in, we see some of the Mecklenburg, so we've not had any kind of those occur in our county, but we get a lot of them for people coming through and vice versa. So we are aware of that kind of out there, but food truck people tell themselves, but and report others, like there's this other truck that's coming through, I don't think they're legitimate, because that's their business and that's what they want, just like.
I don't know which, where I saw that, it was on the regular news that these folks, they can't afford to open the restaurant, so they're open basically a kitchen and wherever they can find space, and then they're selling either directly to people or to restaurants.
So if they're selling for pay, then they would have to be regulated.
Okay,
So
and that's typically in the county where they're located, right?
Correct, yeah.
Okay, all right.
So there is some reciprocity with county lines, like if someone was bringing, for a temporary food event, they bought food elsewhere that wasn't, like at Sam's, they just have to show the receipt that it came from Sam's and it's not part of 10%.
Yeah, this downside of the pandemic, I don't think it's going away. Well, it's downside, upside, but food on order seems to be the way everybody's doing things.
Yeah, the other 2 positions that we asked for, 1, 2 for food and lodging, but 2 for on-site. And that was just the increase in workload that has gone from our 2 weeks turnaround to our 9 weeks turnaround. We want to address that, but we also want to be aware that we have the economic issue of the moratorium that we have. So now that there's no more sewer tap available, how is this going to impact our on-site septic? So anyone that's wanting a new build is going to have to go either through septic or just not built. So we are preparing for that, meaning that we are speaking to Union County, who is a much situation. We're reaching out to our regional, we're meeting with other kind of key players just to kind of gauge what kind of impact that's going to have. But we already have applications coming through for churches, daycares, dog kennels, things that would traditionally just be in the super tapped area are now making septic application. So those are our addresses that we want to be prepared for and be ready.
And those numbers are a little small. I hope you can see them though, that just in 2 years, the volume of work has doubled.
Yeah, especially these contemplative contacts from 600 to 1267. And then it works with our well program because sometimes they go hand in hand, but we've got to increase that as well. But we're not a small county. So we are transitioning in environmental health from small county kind of staffing levels to really mid-level and really more substantial and long-term longevity.
So Union County, with just slightly more people than we have, has more than double the FTEs.
That is correct.
And actually Iredell, fewer people has doubled.
Well, hopefully, it's starting in July, that won't be the case because we will have 2 additional staff.
So having lived in Union County in 2 decades ago, Union County, Cabarrus is the Union County of 2 decades ago. And all that growth happened in the 2000s and Union County is basically a no water county. So it was really difficult. There's no river. They buy their water. They've got one creek, right? You probably know this. There's one creek that's got whatever that heel splitter muscle in it, which meant they couldn't do anything with it. And it was a huge problem. And it was the same kind of growth here, probably more residential and less commercial. But this is the downside of the huge growth and the growth in the population and the growth in higher income population. Lots of good comes with it, but this is the expense that goes along with it.
Yeah.
And I think that these requested positions are funded in the proposed budget for the county.
Right, so far, but it's not final.
Well, it hasn't been approved yet, but yeah, I feel pretty comfortable that it will be. And also the confounding issue is one that a number of people are working very diligently on, as far as the issues surrounding the Department of Environmental Quality and the paper capacity. And so I certainly understand
Well, and we've already, to be transparent, recruited for, and I believe has started working even
next Monday.
One position because we really want to close that 9-week gap. And we figured even if the county chooses not to approve the positions, that we can use some of the excess revenue from cost settlement to cover that because we've got to get more help. Staff.
Well, and I think that's across the board. That's residential and predominantly, I'm guessing, but it's just like our economic development clients. We try to emphasize to them, we want to make this process as efficient and smooth and seamless as possible. And that doesn't fit that mold. Yeah. And not criticizing anybody, but I think you're sharp.
So that's the piece that's just all new permits, or or is that, there's a problem too?
Are you talking about their workload?
Yeah.
So they do new evaluations, so going out, auguring holes, keep it passes for system. It's also septic inspection. So zoning requires that anybody on a septic system that wants to increase the footprint of their house, increase the bedroom, add a pool, shed.
I was just trying to figure out how you got out there where the volume came from.
And then complaints and repairs are really starting to escalate as well.
Right, so it's complaints, but it's, if you want to add, I got it, you want to add someone to your house.
How do you gather data on like the failing, like you said something about failing sewer systems in this county? That's what you're talking about now, through inspections or?
So the failing ones, people call us and say, hey, I need a repair. Either I've been told I need to repair, I can help them like verify that they do actually need it, or someone's just just informing them of what their situation is, and it comes to we issue a repair permit. So right now, we don't charge for a repair permit because your system's not working, and you got sewage like backing up in your house or in your yard. So we have to issue a repair permit for that. So we chart that, how many are issued per month. But the causes of that are interesting, and that's kind of what I want to see in the data trend line.
Yeah, that's what I was interested in.
Yeah.
Is this an age factor? Is it?
Sometimes it's kind of 50-50. Sometimes just the age of the system, like if it lasts 40 years, that's fantastic. And we've been able to see like terracotta that they used in the 20s and 30s and cinders and stuff. Or is people accidentally destroying their system? They didn't know.
My pool isn't going in.
Really early decay of the septic tanks, but in 2 years of brand new systems. People that are on like very heavy medications like cancer, literally will destroy their septic tank.
It's a scary thought.
So that is, and that's very hard to.
Yeah. It's going to be your body.
So those are just different scenarios that we have to look at. But I will tell you, I'm very much looking forward to my presentation next year because we have very ambitious programs and projects we're working on, and I want to be able to show you our success with that. So.
Who can advise one on how to find one's septic tank? Other than digging.
Yeah, talk to that.
So we will look through our records. We have several from 1950, but mostly in the 80s is when our record starts. So we go through and try and find it. If we don't have a record for some reason, we contract with like a septic installers, or we go out there and we can probe.
Krista goes out for the binding rod and she finds it.
It's that wet that's not supposed to be there that just developed. That's right.
Oh my goodness. Yeah, we had a busy water line that wasn't supposed to be there by accident, so.
Yeah.
Thank you very much.
Thank you.
You guys are the unsung heroes.
Yeah.
I mean, you gotta have clean water and sanitary sewer, or you don't have a healthy community.
Sure, yeah.
Is there, and this is a bit off subject, but it does affect. I know that there is a lot going on with regard to Wasatch. Is there any sense of when we're going to get a bit more clarity on Diener and what their feelings are?
I haven't gotten an update recently. You know, we had made the initial request on the paper capacity issue, and I think we were at 80 gallons per day per bedroom, and they reduced, no, we were at 120, and they reduced it to 80. Portions of Mecklenburg are at 60. And so every residential development that's permitted, that capacity is absorbed at that moment, even though they may not be built for a number of years. So by the time that capacity comes online, the expansion will already be completed of the wastewater treatment facility. So there's a lot of waste in there. Yeah, there's millions of gallons of sewer capacity that are not being used because they have been reserved by this paper capacity. And by the time it ever is used, the plant will be expanded. So we've gotten a lot of cooperation in Senator Newton's office. He is working on it. The folks at Wasatch continue to work on it. But I haven't gotten a recent update.
So is the multifamily boom part of this too? I mean, there's way more apartments going up in the past 5 years than.
That certainly is a piece of it. I get the impression that, and there was some relief given on that as well, because it had a higher number. But that doesn't seem to be the primary concern.
Okay.
Well, that's a big factor, and of course, I think you were at that presentation at the legislative meeting for the chamber, and Chad Von Cannon, who was the engineer at Water and Sewer. It is highly impacted by the amount of rain that we have, because we have these very old stormwater systems, and when we have a lot of rain, it infiltrates into the treated plant water, and so that capacity goes way up. If we have a couple of dry years, then we'd have a lot of excess capacity, so it's pretty complex.
Yeah, it is, and actually the briefing, and which I think is a matter of public record, it's out there. It's actually quite good in explaining what the issues are. My concern here is that there will be pressure that will drop on us if there isn't some relief occurring through paper calculations, and I don't want to see you guys bombarded with angry relatives.
Well, with a 9-week lag time, there will be angry, yeah.
This is something that I think is important enough that if you do find any significant or even moderately significant swings in the length of time to keep us informed.
Chris has been letting us know every week where we're at. Getting the additional staff would be very helpful. But it's also very difficult to recruit for these positions. These are hard to fill positions.
Especially when it's 100 degrees out.
Yeah.
It's a topic for, I'd love to, what your background is and how you ended up in this work, because it is important, but I don't even know what the career pathway to get there is.
And that's another thing we're working on.
Yeah.
Is, doing environmental health kind of career exposures.
Yeah.
So exciting. Anybody with a 4-year degree in any kind of science,
Yeah.
like science outdoors, that's our people.
Yeah, but we're really trying to bring awareness at the high school and college.
I don't know, I wouldn't even,
Here's-
I was gonna
here's
ask you,
the
what'd you go to school for? It's not that you got into this.
Yeah.
Okay, next
Okay.
we're gonna move in the health director's report.
Yeah, the health director's report is in the packet. Please take a few minutes to look it over to see another productive and successful month that we've had. I want to call out just 2 things of awards that our staff have gotten, one that's in the report and one that's not. Dr. Suda received the Karen Ponder Award from North Carolina Smart Start. Several of you were at his award ceremony. We're really proud of the work that he and the whole team are doing in the SUN Clinic, the Substance Use Network for Pregnant Women. And the one that's not in here is Aaron Chu was just awarded the Leadership Cabarrus Alumni Impact Award last week by the chamber, and she's on here, so if we can all take a minute. Congratulate Aaron.
Great job,
And,
Erin. Thank you.
With that, we'll move on to the
She's gonna
budget.
have to have a room in her house with all.
Yeah, okay.
Now we move to the consent agenda. I need a motion to move in the consent agenda.
Motion.
I second.
Okay,
Well,
no, I just moved to move this. I didn't move to.
you know, you just have to ask for a motion to approve once Sue goes through it.
Well, you can't have too many motions. I was practicing. So moved.
Good evening, board. Attached are your consent agenda item for budget revisions. We did go ahead and do a budget revision for the Medicaid cost settlement funds that we are anticipating to come before June 30th. And there were some funds that we moved from FY '22 to FY '23. Those are the majority of the revisions. Does the board have any questions?
I need a motion. Do I do one now?
No.
No, I need a motion. I have a little bit, not very little bit, sorry. Have a motion to accept the budget revisions.
So moved.
Dan moved, and second.
Second.
All right, Martin, second. Mr. Spencer, all in favor?
Aye.
Aye.
So I got Asha, and I got
Aye.
and Daryl.
Aye.
So, okay, and then next is the business agenda also by Jason.
So attached is your final budget that we are looking to adopt with the board's approval for FY '23. There were minor changes for an additional $265,000. There was a change to a WIC agreement addenda, and carryover for CD had increased. The finance committee met Thursday, and there were discussions regarding a change to the budget regarding merit increases. We had proposed a 3% increase, 3.25% increase in the preliminary budget. That is still included in the final budget, but we received some additional information. So if the board agrees, we would like to adopt this change, and then we'll bring you a revision in August. The change, do we have?
Aaron, can you pop the slides up?
Yep, hang on just a second.
The change in the merit increase, we received word from the surrounding counties about what they were doing, and with our staff retention rates and our recruitment efforts, we felt that it was prudent to look to the final budget recommendations that surrounding municipalities are doing. So our request is to do a 3% across the board COLA or for our employees, and then a 2% merit. So the maximum that a CHA staff would get would be 5%, but that for retention, appreciation, inflation in our neighboring communities. So if the board has any questions about the final budget, please let me know. Otherwise, I ask that you accept the budget as presented, and then we will move forward with looking at those increases for staff and do a revision as needed in FY '23. Any questions? There is also, Aaron, our budget ordinance that's accepted by the board that Dr. Pons and will sign. It just breaks out our total budget by funding source and by our department. So that is after the budget. It's included in your slides. Our fee schedules are once again included in there, and our property summaries.
Okay. Thank you very much. What's the next public hearing?
We have to adopt the budget.
With the budget as whatever's that amended.
We need to do a public
Public
hearing.
Yeah.
If anybody in the public has a comment about the budget,
Oh,
if anybody submitted any questions about the budget.
I do not believe that any questions have been submitted. Ryan, Rakisha, Aaron, are you seeing anything in the chat or any submissions?
No submissions.
I think I see Aaron shaking her head now.
Okay. Okay. And so being no public comments, we need a motion to adopt the fiscal year '23 budget. I have a motion.
So moved.
Mark Spitzer moved, a second.
Second.
Dan Hager, second. All in favor? Aye.
Aye.
Sarah? Tim?
Yes.
Aye.
Okay, got all three. Thank you. Okay, and then,
I do want to ask for clarification around the issue of this budget as just approved currently recommends the 3.25%. But we would like your approval on coming back in August with that modification to increase to a 3% across the board and 2% merit to stay in alignment with what other local municipalities and health departments are doing. Is there any questions about that?
Do you want to explain the delay from putting it into the budget now?
Well,
as I understand it, don't you guys have to do something?
No, that's a different piece.
No.
Sorry.
Different piece, yeah.
No, because this would be funded with our cost settlement revenue.
Yeah, and so I would imagine that probably that flexibility could even, I mean, that could change depending on market conditions that to retain and, yeah.
But it's really only a 1.8% change, because the 3.2 was already in the original, and it's a total of 5, so it's not, and the difference is, I missed it with the prior discussion. It was already built into the budget. We had the discussion with the one I was there for, that it may not be enough, given the situation, and you brought back, or you guys had a discussion around something more, and that you have data. So it's not a very big change, actually, from the budget that we had already planned on putting, and that was the one that was covered. It was covered. It was a covered budget.
So this is a matter of being prudent. So we have brought in the settlement. Yes.
Well, now we got it, so I think, I guess it's not in the bank yet, but it's coming. You know a number.
We know it's coming.
And you know it's coming.
We have a signed letter from North Carolina Department of Medicaid.
All right.
Good.
Hopefully they're good for it. State stuff's not being good for it, then we're really in trouble.
Yes.
yes, okay.
So what we gonna approve the budget as written, and then you're gonna come back with the revision?
Yeah.
So,
Yeah.
all right, so that's.
That's what I understand. Okay, and now, the finance policies?
Yes. I have 3 policies for finance for the board's approval. The first one is the public health and primary care services fee policy. There was a change in there regarding, Erin, if you'll go to the section in red, our MAT patients. So that was added to this particular policy, individual seeking treatment, for substance use disorder through the maternal health clinic with pending Medicaid status will be charged but allowed to defer payments after the 50th day. And then when the Medicaid application, if it's still pending, they will be responsible at that time. So we've gotten a lot of patients saying that their Medicaid applications are pending. So we'll give them a 50-day period. The public health primary care services eligibility policy has minor changes in it. And then the contract and procurement policy, we started a policy in 1997 and just added and deleted from that. The flow was not easy to read. Now we have a lot of delineations between the funds come from the feds or the state or where they earn. So we updated the policy to reflect an easier to read and very accurate and on the funding source. So would be funding that. So those are the 3 policies that finance is asking you to approve the city.
Okay, any questions about that? Anybody out there have questions? Okay, can I have a motion to approve these 3 finance policies?
So moved.
A second?
I second.
Second.
Okay, Asha, and, so all in favor?
Aye.
Okay,
Aye.
Darryl? Okay. Asha?
Aye.
Okay, so that's passed.
Thank you.
And next, we have a personnel policy update by Dr. Cathcart, please.
Yes, the most exciting part of any meeting, personnel policy updates.
Wait a baby breath for this. I'm so excited.
Right. I have to say, there are no personnel policy updates at this time.
Oh.
No updates at the time. I may have, and I know last year we had a ton of updates, but there are no updates at this time. There may be some updates by the August meeting or September meeting, but I'm not ready to present those yet. So at this time, there are no updates.
Okay, thank you. Now we have the board governing document reviews. Dr. Coyle.
For accreditation purposes, our Board of Health corporate resolutions and operating procedures must be reviewed each year. So they were in your packet. I will tell you that for the corporate resolutions, there were only very minor, actual more like grammatical error fixes. So there's no substantive changes. They are as they were in last year. For the operating procedures, the only change that we inserted was that it was currently worded that the Board of Health meets every second Tuesday of the month at 5:30, and we have moved that to third Tuesdays in every other month. So I just changed it to we are meeting at least 6 times per month. I figured it to be more general. So if we move the date or, or day or something, we're not having to redo the policies again. So that was the only change in that one. So with that, then we would need a motion to approve these again
Okay.
for the
Do
year.
others separate or kind of come together? Got it together?
I think, yeah.
Okay. So I need a motion to accept the corporate resolution. And
I make a
operating
motion.
procedure changes. She's helping me out here. Second?
Second.
Mark Spitzer, second. All in favor?
Aye.
Aye.
And I'm Darryl, Kim,
Aye.
Aye.
and Asha.
Aye.
All right, that passed. Thank you. And now Concord lease space. Bonnie.
Yes, and I apologize, this has a motion next to it. This is for information purposes, as the board does not have to approve space. But I did, Commissioner Morris brought to my attention last month that we have not updated you about some new space that we have secured. So as you've heard over the past year, as we've talked about the growth in programs and that, and the COVID funding, CHA staff has grown by 21% since January of 2020. You will see on the next slide that that is well over 50 employees, and we actually still have 20 unfilled positions, so that we will be at around 300 employees once we fill those positions. So that has really strained our capacity to house the staff at just the Kannapolis location. So we were able to use some ARPA funding dollars to secure additional space down at what is affectionately always referred to as the old creamery. I mean, everybody still thinks of it as the ice cream place. And on the first floor, we have located our community health workers, our case management program, and some of our community-focused grant programs, especially those that are working with the school districts. And on the second floor, we have secured some space for our new behavioral health grant-funded programs, again, through ARPA dollars and county dollars. We're extremely grateful to the county for providing those dollars for us to secure several additional counselors who can help folks who are dealing with the mental health impacts of the COVID pandemic. And then we have also been given the opportunity to secure a little more space on the second floor. And we have decided to move human resources there. We have had one of the issues, concerns, complaints that staff have brought up to us is that, right now our HR department is right up here in open, we're in this open floor plan here. And they are at cubicles and there are not floor to ceiling walls. And sometimes staff are concerned that conversations and things might be heard and it's just not presenting the confidentiality and professionalism that we would like. And so that opportunity to move them there, it puts them more central in the county to our Dream Center location. And for the school nurses who are coming from all over the county, from the schools and that to meet with them and get information. And so we plotted on here, our blue star, I'm gonna have to move within the county. This is our Kannapolis location. This is the Dream Center where we already have WIC and some of our dental services. And then this is this new location at the Creamery site, and this is the Youth Development Center for Cabarrus County for the Juvenile Detention Center. And so I thought that was good to sort of map this for you, so that you see the majority of our clinical services are here, and then some are here. And, one of the things we're doing this year, and we'll hear about in August, when we do our sort of strategic plan, are these services centrally located and available to people who need them? And need to think about a satellite app here or, something down in this area. So, but here you see that we have gone to, as of right now, we have 282 staff with 20 open positions, so that could be as much as 300. And so we have been really sort of bursting at the seams as we have grown. And so, would love to have further discussion at August's meeting and future meetings around thoughts and, as we bring you, so we're doing some really neat analysis of data to look at where are our lowest income areas, where are our Medicaid patients coming from, and using our community health worker program to learn more about where are the pockets of community members who are not able to access services and who may really struggle to come all the way up to the far end of the county to receive some of those services. And so where might we strategically look with a larger sum of ARPA dollars that the county has granted us to secure a fixed site for some satellite service.
I would look forward to that conversation. I think it's really an important conversation for us.
I agree, and I think that's something that we at the county have been looking at as well. I think when our human services department was located here in Kannapolis in the old Kmart building, that was the location where a lot of the clients were coming from. And it's my understanding that has changed and that it is more equally distributed throughout the county. So we're looking at ways to improve that. And as you mentioned, if you're in Midland, all the way at the bottom, you have to go to absolutely furthest length of the county to get to this facility. So having the satellite services, I think, is a really smart thing to do.
So do we co-locate?
Do what?
When you go, do we go?
No.
What do you mean?
The county spreads out the health department spreads out.
I think there may be some opportunities.
That's what I mean.
Yeah.
Yeah, I mean, it's the same issue as transportation where the community is.
Right.
And that's got to take into account that we do have options now with virtual stuff, but these communities may not have.
Yeah.
And that's the other thing, mobile's the other thing.
Well, we also have some funding from the ARPA for that.
So it
too.
just seems like it's cheaper for everybody if you do it together. That's the only thing.
Yeah, and we've, a couple of conversations we've had and potential sites that we've looked at, we're already thinking like co-location, how do we align with other county social service programs and, that's one of the really nice things about the Creamery location. Thank you. There's, the legal aid is there in that same space, which provides legal services to low-income folks. There's a veterans organization there. There's a number of other
services.
social service type facilities in that location, so it really creates a nice.
Yeah, I mean, if we do this, it would be helpful. I mean, to me, I always look at that as where the roads are and then where's the, I don't know it, but where's the bus lines? Those are the things you have to know how to serve the community.
And not to forget our rural areas.
Yeah, that's the thing.
Mount Pleasant is one of
That's one of the big roads in the county.
And I think that doing the vaccine clinic showed us just how nimble we can be with moving our services out to the people, taking it out to the people instead of bringing it here. So I think that was.
It's a big county.
It is.
I wonder if rural green might be of value in counties, in identifying counties that are ahead of us in
in that more satellite type approach.
Yeah, rather than reinventing the wheel.
Yeah.
And I think, one regret that I have about the Creamery location is that the county did not purchase that building because we are now, with the Health Alliance being there, the primary tenant. For the entire complex, yeah. And so, who knows, we might look at that down the road, but, that's what we're doing with our senior centers. We're co-locating with the library in the Afton area, and we're getting ready to do the same thing in the Mount Pleasant area, which will free up a building in Mount Pleasant adjacent to, which we talked about some possibilities with the Health Alliance there. So, I think that collaboration is important.
There's just a lot of overlapping services.
Yeah.
Things. These people who don't have transportation, they can do more than one thing.
Yeah, well, the space, as Commissioner Morris mentioned, out in the Mount Pleasant area that we've just, very preliminarily looked at, is right next to where there's the family practice site. So boy, then if you took dental there and WIC, and you put some of those, additional public health services, boy, that would be a nice, right.
And that also is much more accessible to the Midland area of the county as well.
Well, I mean, as the development pushes some of the low income people farther out, that's what you have.
Yeah.
Yeah, we have a very large, is it Tom laid out there? I don't remember. There's a large housing area out there, new in Mount Pleasant.
Some of the subsidized.
Yes, thank you. So there's the population is growing there, and the need is growing with that. So, because they have to walk to the grocery store, but it's pretty closely located to the grocery store and convenience store. So that's good. The location's good, so.
Welcome to the burbs.
Yeah.
That's I know you would have. We're gonna have to move even farther.
All right. So that's the end of our public announcements. Any other announcements or questions, or I just want to thank everyone for your time and I think.
Yeah, I just want to add very quick that I have used and recently used the services of the Alliance. I mean, for my vaccinations, with COVID lately, last Thursday in the mobile clinic, with my daughter here who completed, all her immunizations, dental, and I just, it's everybody's so professional, so caring. The place is great. So we have to be really proud of, all the work that you're doing here and that all the staff are doing. So commend you for that.
Yes. Thank
It's
you.
a great team.
Mm-hmm. Motion to adjourn?
I have a question.
Oh, sorry.
We're supposed to meet the third Tuesday of every month, every other month. So why are we meeting tonight?
Because we have to approve the budget.
And so we had to bump it.
We have, so we will always meet in May and June. So that's the, you know, so those will be back-to-back months. We moved it up a Tuesday because our chairman is going out of the country.
That's right. I remember that. Well, I remember something on the second Tuesday of the month, and I thought, yeah, how does that conflict on that?
Yeah.
Now, I remember, yes.
So-
It's Laura's.
My fault. I couldn't-
Yes, and so perhaps she should be required to invite us.
Us along. We did offer to come to the meeting on her tour, but.
Yeah.
Please go.
I just have a couple of things also. We used to have computers. And
Yes, we each had a computer at our station so we could see what was on and they disappeared during COVID because they took them to use them for.
which was
feedback
really
things.
great, because you didn't have to
Yeah.
kill trees by printing.
Yeah, and that was very difficult to see. So I will talk with,
And we,
Brian,
our
and
station had a computer. with
that's
us.
a
They did
lovely
work on
idea,
it.
yeah.
That was really nice.
Yeah, I've got like Dan said, an iPad, whichever. Might be cheaper.
The other thing which, came to my attention in a conversation I had at the bakery.
The Health Alliance typically does not endorse items from the bakery. Go ahead. I do.
Donna Taylor, who runs the bakery, is very interested in making sure that their facilities are open when there's events going on. And she learned of a event that was happening on Saturday, but didn't know who it was that was doing it. I think it was us, was part of it
Where's this paper?
in the village.
Oh,
Just cake or.
the walk, I'm talking about the Walk to Win event that was on Saturday.
Yeah.
Okay.
My point in raising this is, and I apologize for my ignorance, do we have a calendar of events on our website?
This would have been posted there, but I don't believe we necessarily have it as an actual calendar, so that would be something we can.
Could I make the recommendation that when we have events, that it is posted on Kannapolis, Cabarrus, Concord, and anybody else who's got a calendar so that people know about it?
Mhm. Yeah, no, we should do that for trying to get the word out.
Yeah, there's too many good things that we're doing and for people not to know.
Yeah, and to explain on that, that is an issue that we've tried to address for a number of years between the county, the municipalities, the Chamber of Commerce, to try to come up with one unified community calendar.
Yeah.
So folks, let's say if the Red Cross is going to have a fundraising dinner, they can go to that calendar and say, well, we probably should stay away from this date. So
Yeah.
Debbie Brannon at the county was kind of heading that up until her retirement. So I'm not sure where that has landed, but I agree, and I think it needs to be a coordinated effort. So.
Yeah, and I think that at least getting it posted on places that are there would have interest would be good.
Yeah.
I agree. I think it's actually a software opportunity for someone to come up with a calendaring system that allows for multiple different agents for that's.
Yeah.
If you've ever looked online trying to find an event, like what's going on what's going on in my area, it's hard. Yes.
Like a shotguns.
I thought that would be a slam dunk when I searched for that one day, and it was like, nothing there.
I'm back from mine.
Okay. May I have a motion to adjourn?
I move to adjourn.
Thank you very much.
That
All
would
in
be a
favor?
good
Aye.
investment from the chamber.
Yeah.
I.
Asha, Kim doesn't want to leave.
Aye. Aye, aye, aye.